It's time to talk health. You all sent us your questions about common ailments from hiccups to eye twitches and what you can do about it. Our ABC News medical correspondent, Dr. Darien Sutton, is here with all the answers. Welcome. Good afternoon to you. Our first question is from a viewer named Kate. Let's take a look.
Hey, Dr. Darien. Sometimes I feel my eye twitch throughout the day. What's causing it, and what can I do about it?
I've had that before. I never really thought.
All of us have had it. We are all okay. I can promise you. Thank you for answering the most important question, because probably, we talk about high blood pressure, diabetes, but these types of questions are what bring people to asking doctors at any point in time. So it's called a blepharospasm. It's another word for your eye twitching. Now, most often it's due to things that we can control. For example, our caffeine intake, or even exposure to nicotine, sleep disturbances, or lack of sleep, and even potential vitamin imbalances. When we talked last week about vitamin D, magnesium, B12, those are common culprits of this. But most importantly, it's usually a stimulus like caffeine or alcohol the night before that might be causing it. You really don't have to worry about it, but if you have other symptoms, for example, numbness or weakness to other parts of your body, you should get it examined because it could be a part of a larger picture.
Okay, important distinction there. Next up, our viewer Christine has a question. She says, quote, I sometimes get random nosebleeds. What is the best way to get them to stop?
Yeah, well, this does bring patients to the emergency room, especially when they're rapid and you can't stop them. So one thing that you can do is to not do what you see on television. Normally when you see people with nosebleeds, they pinch their nose in the wrong way and they lean back. That causes you to swallow a lot of blood, and that can be just uncomfortable. So if you do get a nosebleed, and we can all do it, you want to feel on your nose, you have your bony part, and you want to pinch right below where the bony part ends. That's the sweet spot for a nosebleed.
Oh, there's a
and
little
most
space
importantly,
there.
exactly, you feel that? You want to lean forward. This allows you, and you want to hold it for 10 to 15 minutes. Now in 2025, 10 to 15 minutes, as well noted, is a very long time. So you got to make sure you hold it, no peeking, and avoid blowing your nose for at least a day or two.
10 to 15
And
minutes.
blowing your nose for a day or two?
Yeah.
That sounds even worse.
I know, these things can be, but it can help prevent you from going to the ER.
Where's the tissue box for Gio?
He's like, I'm going to do the old way.
We do have one last question.
Yes.
This one is from Liam.
Hi, Dr. Darien. Why do I always get the hiccups? What can I do to stop them? Thank you.
Liam looks just like one of my good friends, the son of our producer, Jessica Yankalunas. That's so interesting. But really important question. I'll answer it as if I'm talking to my pediatric patients. Liam, so sometimes our bodies do things that we can't control. We breathe, we blink, and for the same reason we have hiccups. A big muscle in our stomach is called our diaphragm, and sometimes it twitches, and that causes air to go in our lungs, and that causes our voice box to close, which causes that sound of of a hiccup. And so often it's due to just irritation. For example, if you drink something bubbly, or again, if you're having lack of sleep or stress. Many times the ways to stop it are to stop the reflex of our hiccup. It's a transfer from our brain to a nerve to our diaphragm. So some ways you can do that is holding your breath, expanding your diaphragm.
So that's real. Holding your breath is
holding
real.
your breath.
Oh.
Drinking something cold quickly. It can the reflex of the vagus nerve can re-stimulate it or reset it. Also, other things that you can do. It's not standing on one foot. I know that Liam probably thinks that is something that's accurate. That's not going to change the outcome of your hiccups. You don't have to be worried about hiccups unless they last longer than a day. And I have had patients where they do last longer than a day or two, and that requires a workup, because it could be a problem with your brain, the nerve that supplies your diaphragm, or your diaphragm itself. So that does need to be worked out.
Scaring someone?
Doesn't.
I don't think scaring someone works.
But it is fun. I like that one.
I do a scoop of peanut butter.
A scoop of peanut butter has not been validated in the studies, but if it works, it works. I will say you could try a squeeze of a lemon, because certain things that are sour can reset that reflex.
I bite a slice of lemon like I'm eating an orange.
And that is a trait or a trick that does work.
Yeah.
That is
I drink from the opposite.
Yeah, I
cup,
do that too.
The opposite side of
I
the
think the only thing that
All
will
right, all
have
the tips. All
are
the
people
tips.
maybe laughing at you.
Everybody, thank you so much.